And welcome back to Talk of Alabama. Joining us now is Dr. Daniel Doleys, director of the Doleys Clinic here in Birmingham. He's also the author of Understanding and Managing Chronic Pain, and he's here today to talk about the disease that affects so many Americans. And first, welcome to you.
Thank you.
How many Americans does this affect?
The last estimates are that about 20% of people, or 100 million Americans, are suffering from chronic pain. It is the single most common cause of disability in America. It costs more to treat chronic pain than it does to treat heart disease, diabetes, or even cancer.
That's amazing.
It
you
is.
Really think of the numbers.
What
exactly is chronic pain? How would you describe it?
Chronic pain is defined as a sensory and emotional experience.
Okay.
So it's well beyond just an injury. What we're beginning to understand is that information is transmitted from parts of the body to the brain, and the brain sort of massages that information much like your cell phone massages electrical impulses.
Okay.
And it turns it into what it is we experience, and that is the disease of chronic pain.
Mm-hmm. And what about the people out there that think, oh, it's just a psychological issue or a motivational issue, and it's not a real thing?
That's a common misconception, and it's no more true of chronic pain than it is of diabetes or high blood pressure. Do psychological factors play a role, and are they important in the management and treatment? Absolutely. But psychological dysfunction is more often a consequence of the chronic pain than it is a cause. The Institute of Medicine put out a report in 2011, and they chronicled a variety of things that contribute to what's called chronification.
Okay.
There are things that even appear in infants that may predispose them to chronic pain in adolescence. There are psychological issues, lifestyle issues, smoking, overweight, lack of exercise, medical issues, physical deformity. So all of these things play a role in the development.
Is there any way to really identify where the pain's coming from when you've got chronic pain?
Well, essentially the pain, if you will, is coming from the brain.
Okay.
Because whatever affects the brain is going to affect the experience of pain. And
Okay.
that's been the confusion, because the brain is not just a psychological mechanism. So you can look for physical abnormalities. If you have a herniated disc or something that's going to compress on the cord, that could be a contributing factor. You may have to operate to protect the cord. Mm-hmm. But even though you fix that problem, and we see this frequently, people have surgery, the problem is repaired, but they continue to have pain because it's well beyond the nature of the physical injury.
So then you bring up a good point about surgery. Are there surgeries or maybe even medicine for those out there suffering from chronic pain?
There's no specific medicine or surgery for chronic pain. Again,
Okay.
This is a processing mechanism. It's part of what the brain does. Now, surgery can be very helpful in
Okay.
eliminating things that may be threatening the individual, such as cancer and tumor and so forth. Medicines can be helpful, but in and of themselves, they are not treatment for chronic pain.
And in closing, how can you at the Doleys Clinic help those out there suffering from chronic pain?
Our approach is more multidimensional. So we have people that deal with nutrition, lifestyle, exercise, physical therapy, behavioral counseling, acupuncture, medicine, implants. So you have to take a comprehensive approach, and you have to be there because people change over a lifetime. What somebody needs in their 30s or 40s may be very different from their 50s and 60s.
Well, we want to mention you've got these two books on the table here. Obviously, this one titled Pain, this one Understanding and Managing Chronic Pain. You can pick up a copy of one of these books. Just look them up on the internet, I assume?
Yes, they're available on Amazon. They're available through our office. Oxford Press put out the one book, and then Outskirts put on the other one.
Okay, so if you suffer from chronic pain, something you certainly want to look into. As the doctor said, it's been misunderstood for years, but with technology and psychologists like yourself, you guys are making huge strides in it.
Thank you.
Thank you so much for being here.
Thank you.
We appreciate your time, doctor.
Thank you.
Okay, we've got to take a quick break, but we'll be back with more Talk of Alabama. Uh-oh, comedian Cheryl Underwood joins us in the studio. What's she doing? It's time to let out some laughs on this Friday. You're watching